Do you operate on bingo wings?
Patients often ask about, it's a nice phrase, isn't it? Everybody knows what it means. And again, there is an operation which works really well called brachioplasty. But brachioplasty leaves a scar that goes all the way from your armpit to your elbow. It's very fine. It's placed in such a way that when your arm is by your side, it's hidden. And when it's mature, it should be narrow, pale, soft, and flat, and not at all obvious. But there is not another operation that works really well. So people will often say, well, can't you do it with a scar in the armpit? Well, the answer is yes, it's called axillary brachioplasty. The only trouble is it doesn't work. I've done it and have been almost universally disappointed. So the answer is yes, there's a very good operation. You have to accept the scar, though. If you look at the photographs of the scars, when they're mature, they're good. But again, maturation is a year. You have to be quite patient. A lot of patients will say, though, well, I won't wear a short-sleeve dress or a no-sleeve dress or a short-sleeve T-shirt in the summer anyway. So to have to cover it up for the 6 months of the year that it's summertime for 1 year is not a big deal for me. But it's an operation that if a patient looks at the photographs of the scars I show them and goes, God, no, I don't know, then the answer is, well, don't do it. But if you accept that, again, it's an extraordinarily, I can't, honestly, I'll hand on heart, I can't think of a patient who has expressed dissatisfaction with brachioplasty, but every one of them knows about the scar before they start because I show them photographs of it. Exercise is a good thing because, of course, it builds muscle mass and makes muscles firmer. So although brachioplasty is an operation which focuses on skin and fat, not muscle, but the firmer the muscles are, the better the result's going to be. And certainly you can go back to any kind of exercise you want to afterwards.